What is Bell's palsy? Bell's palsy is a disease of the nerve which leads to sudden weakness or paralysis of the entire one half of the face. In other words, it causes weakness of both the upper and lower facial muscles. How common is Bell's palsy? Bell's palsy affects both males and females equally and tends to occur more so in the mid to later life. In the U.S., the incidence of Bell's palsy is seen in about 25-30 out of 100,000 persons. How does Bell's palsy come about? To fully understand Bell's palsy, it is important to get a basic understanding of the nerve involved, called the facial nerve. The facial nerve originates from the brain where it receives nerve signals. It then travels from the brain, passing through several openings or windows in the skull, giving off tiny nerve branches in the process to several structures in the face. These branches control several structures in the face, including the tear gland, also known as the lacrimal gland, which helps produce tears to help lubricate our eyes. It also controls sensation at the front part of the tongue, helps with tasting. Furthermore, it controls the muscles in the throat, which helps with swallowing, muscles in the inner ear, which helps with hearing, the skin surface just behind the ear, which helps detect touch sensation in the back our ear. Finally, the facial nerve helps control muscles on either side of the face, which help with facial movements, such as moving the forehead muscle, closing the eyelids, moving the nose and upper lip muscles, raising the corner of the mouth when we smile, and also moving the lower lip and chin muscles. Remembering these different functions of the facial nerve is crucial in explaining the symptoms seen in Bell's palsy, which will be discussed later. What is the cause of Bell's palsy? The underlying cause of Bell's palsy is unclear. However, some studies suggest that it may be caused by an infection of the facial nerve by a virus called the herpes simplex virus. Other studies point to a self-induced immune attack of the body against the facial nerve. In other words, the body produces attack proteins called antibodies that attack the facial nerve, thereby damaging it in the process. What are the risk factors for Bell's palsy? Some risk factors that increase the likelihood of having Bell's palsy includes pregnancy, diabetes, high blood pressure, having a weakened immune system, and recently having a viral upper respiratory infection. How is Bell's palsy diagnosed? Bell's palsy is diagnosed based on a combination of several factors, including the type of symptoms experienced by the individual, the triggers for these symptoms, and the physical exam findings of the patient. Bell's palsy presents as a sudden facial weakness that may worsen in severity, especially within the first 2-3 days. In patients with Bell's palsy, any one or more of the different branches of the facial nerve may be affected. Hence, some of the symptoms seen in Bell's palsy includes inability to move one side of the muscles of both the upper and lower face, dry eyes on the affected side due to lack of tear production, loss of the sense of taste, and difficulty swallowing. Other symptoms include increased sensitivity to sound. In other words, sounds of normal volume would seem unbearably loud. How is Bell's palsy treated? Management of Bell's palsy typically involves the use of steroids to help decrease the inflammation of the facial nerve. In some cases, patients may also be given a course of antiviral treatment such as valacyclovir or acyclovir. Additional treatment approach involves reducing the level of discomfort on the patient due to the condition, such as the use of eye patch or eye protection to help protect the affected eye due to difficulty closing the eye. The use of eye lubricants to help reduce dry eyes on the affected side. What is the long-term outcome of a person with Bell's palsy? About 85% of patients with Bell's palsy will experience some degree of recovery from their symptoms, especially within the first 3 to 4 weeks. Even without any steroid treatment, about 70% of patients with Bell's palsy will eventually experience full recovery of their symptoms. With steroid treatment, however, about 90% of patients with Bell's palsy will fully recover. It is worth noting that even in patients who do not fully recover, about half will only have mild symptoms, while another half will still have moderate to severe symptoms. Here are some questions to ask your doctor about Bell's palsy during your doctor's visit. Can a stroke mimic Bell's palsy, and if so, how can I tell the difference? Can Bell's palsy be passed on to my children? How long do I need to be on steroid treatment for my Bell's palsy? Do I also need to be on antiviral treatment like acyclovir? Are there side effects I need to worry about while I am taking steroids? Here are practice quiz questions to test your understanding on Bell's palsy. Question 1. What is the nerve affected in Bell's palsy? A. The visual nerve. B. The facial nerve. C. The hearing nerve. D. The smelling nerve. E. The swallowing nerve.
Answer: B. The facial nerve.
Question 2. What is a common symptom of Bell's palsy? A. Weakness of one side of the face. B. Blindness. C. Inability to walk. D. Dizziness. E. Nausea and vomiting. Answer A. Weakness of one side of the face. Question 3. What is the function of the facial nerve? A. It helps move the muscles of the face. B. It helps maintain balance. C. It helps coordinate hand movement. D. It helps maintain a good night's sleep. It helps with breathing. Answer A. It helps move the muscles of the face. Question 4. Which of the following increases your risk of developing Bell's palsy? A. Obesity. B. Anxiety and depression. C. Having a stroke. D. Having a viral upper respiratory infection. E. Having an upset stomach. Answer D. Having a viral upper respiratory infection. Question 5. How is Bell's palsy treated? A. By using antibiotics. B. By taking aspirin. C. By taking medications to lower your cholesterol. D. By using Tylenol. E. By using medications such as steroids. Answer E. By using medications such as steroids. Thank you for taking the time to learn with us today. We trust that the information presented today was of help to you. If you found this information helpful, click the subscribe button. Until next time.